This segment is sponsored by Lighthouse Dental Group.
Well, I am back in Bridgman, Michigan at the Lighthouse Dental Group, joined by my good friend, Joy Almeter. How are you this morning?
I'm good. How are you?
I'm good. You know, I'm learning so much on my visits here, and it's all great information. One of the things that struck me recently was, you know, when you think about cancer, the awful C word, right?
Yes.
People, I never in 100 years would have thought oral cancer, but it's a big thing.
It really is. Actually, there's over 200,000 cases diagnosed each year in the U.S. And every hour of every day, there is someone who dies of oral cancer.
So what are the things that you do as a dental practice that will help detect oral cancer? You've got some pretty sophisticated machinery to help you in the detection process, don't you?
We do. Well, first of all, one of the oral squamous cell carcinoma is made up of 90% of most all oral cancers. It's very fast growing and it multiplies very quickly with very little signs and symptoms in the early stages. So that's why it's difficult to diagnose very early on. Sometimes it appears as a little sore on your lip or in your mouth that won't go away. Other times it'll appear as white patchy areas on the sides of the tongue, in the cheek area called leukoplakia, and sometimes there are red patches called erythroplakia, or a combination of the two.
So it's really important to detect it early because of its fast-growing nature.
It's really important to detect it early. So we recommend our patients come in every 6 months, twice a year, to be evaluated. So if you think about it, we only see our medical doctor once a year. So a dental professional is much more likely to diagnose early stages of oral cancer. So it's really important, first of all, to come to see your dentist. Secondly, what we do is we feel the jaw area, the neck area, any places we have lymph nodes, we're looking for enlarged lymph glands.
Sure.
We're looking inside the mouth, we're feeling the floor of the mouth, underneath the tongue, the sides of the tongue, inside of the cheeks, the hard and soft palate where the tonsils are, looking for any areas of concern.
Well, I understand you have quite an instrument that helps detect the oral cancer in the mouth. What is that called?
It is called the Velscope VX.
Okay, and what does it do?
And what that is, it emits a very bright light, almost blue in color. We shine it in the mouth, underneath the tongue, and in all areas of the mouth, and it brings out the natural fluorescence in our tissues of the mouth. So when the dental professional is in there with the scope, they can see these abnormalities much clearer, the little tiny minute areas that we can't really see with the naked eye.
That's awesome. And not everybody in the region has that equipment.
No.
That's something that you offer that kind of sets you apart a little bit.
Yeah, there's also a device on the end of the scope that we can take pictures.
So one of the things that I have learned from my trips up to Bridgman here at the Lighthouse Dental Group is that you do a really great job of kind of servicing the whole health of your patient.
Yes.
And this is just another example of that, which is, you know, like you said, I might not go to the doctor maybe just once a year,
yes,
and he might not have caught that.
That's
because
right.
the doctor's not necessarily dealing with your mouth.
That's right.
So it's really, really important to come to the dentist, even if you're a little anxious. These people are so friendly. There's nothing to be afraid of, for sure.
That's right.
I have to ask, so interestingly, for our friends who maybe have had their teeth removed and are wearing dentures or false teeth, is it important for them to get screened as well?
Absolutely. Even if you don't have any teeth at all or have just a few teeth, chances are the process that, for the reasons you've lost your teeth to begin with, may predispose you to some oral cancers. Mm-hmm. So it is even important to come in, let us look underneath your full denture, partial, examine the soft tissues of your mouth so that we can screen them just as much as anybody else if they have teeth.
So the moral of the story is, from your first tooth to your final day,
yes,
the dentist is definitely needed.
Definitely need it. Go see your dentist every 6 months. It could save your life.
And you have some amazing specials going on. Often you have some great things, and so we'll take a look at some of the things that they have to offer that might be of interest to you.
Okay.
You can always call 269-465-3001, the Lighthouse Dental Group, to get an expert to kind of explain the details of the specials that they have going on. But I know there's some $25 off discount health plans. Regular price is normally $299 for some services, and you can get a discount on some of those. Again, the phone number is 269-465-3001. It's right there on your screen. Pick up the phone and give them a call today. You won't regret it.